Hi and hello everybody. Today we are going to see what are the most common causes of chest pain and how do we manage chest pain and what are the treatments. Okay, because chest pain cannot just be heart attack. If I have chest pain here, I don't have to be panicked. You know what I'm saying. Oh my, I got a heart attack. You don't have to be like that. But unless you have some certain risk factors, for any diseases, for any disease, for that sake, if you have certain risk factors, you need to be aware of all these risk factors. Okay, for example, if I have a chest pain, in order to say that this chest pain is because of my heart, if I have like a smoker or alcoholic, or if I have a high blood pressure or diabetes or high cholesterol or some other risk factors like obesity, there are some, and family history. If I have some of these risk factors and if I get chest pain when I climb stairs, like not like, for example, like one flight of stairs, and I get a severe chest pain or pressure like discomfort, I should be worried about this chest pain. On the other hand, I have no other problem. I'm not a smoker, I'm not alcoholic, and I don't have high blood pressure, no diabetes. I mean, family history is not that significant, you know what I'm saying? My risk factor is not very bad, you know what I'm saying? And I don't smoke, but I drink occasionally, like once a month or something. So risk factor is not that significant, and I have some discomfort pain, which comes on and off, not related to exertional activities, you know what I'm saying? So this pain cannot be coming from this heart. This chest pain can be a simple reflex like an acidity, or it can be some muscles pull or muscle strain. Okay, so you have to have some ideas about this chest pain. Okay, so let's before I get into this differential diagnosis, okay, if a chest pain happens, if a chest pain takes place in we need to have a differential diagnosis. A simple differential diagnosis, like it could be acidity or reflux, you know what I'm saying, or it can be just costochondritis, you know what I mean, or esophagitis, or sometimes you could have popped in a pill and that could be causing esophagitis. So you should be able to change your lifestyle factors to get rid of this chest pain. You know what I'm saying? So, for example, on the other hand, if a serious causes of chest pain, like myocardial infarction, myocardial ischemia, this is a heart attack. Okay, cardiac attack, heart attack, myocardial ischemia, myocardial infarction. Before we get to that, like stable angina. So angina is a chest pain. Okay, angina is chest pain in which is stable and unstable, and coronary diseases like coronary disease syndromes, for example, STEMI, like in which ST elevation MI, when you take ECG and on the ECG, if you see ST elevation, the elevated changes, the elevated waves, if I see that ST segment elevated, then it is a full-blown heart attack. Okay, myocardial infarction is different from myocardial ischemia. In myocardial infarction, there is a complete loss of blood supply. In ischemia, it's not a completely lost, it's a nearly, 70% or like 50% of blockage still sitting in the blood vessel, causing the blood supply to be decreased. You understand what I'm saying? Okay. And other than this heart causes of chest pain, there are other, like for example, like aortic dissection. You have this big aorta, the blood vessel coming out of the left ventricle, and if there is a simple tear in the blood vessels, aorta is a major blood vessel coming out of the heart and going down the tummy. If there is a simple tear in the wall of the aorta, and then because of that pressure that heart puts out, the pressure that seeps through the arterial wall and makes a complete tear. For example, you build a house and then water seeps through the wall. You understand? Because of the crack in the wall, water seeps through that. That's one of the. I'm trying to give an example, nothing else. And pericarditis, you understand? And there are serious causes and simple causes like gastritis or simple costochondritis. Simple causes are there which can be treated if given right medication. You understand? So risk factors are the most important thing that you need to keep that in mind. So genetic risk factors, you can be able to do anything about it, because those are the gifts given by your forefathers. But other risk factors like smoking, alcohol, and your lifestyle, what you eat, what you are, they say, right? Yeah. So you must make sure what you're eating. So you must look out for a right diet. Don't eat like high fatty diet, like a food that is dry, fried in oil, like fried food items you must be able to avoid. Okay, so these risk factors. So chest pain. Okay, if I take ECG, I have severe chest pain, I have this BP, sugar, cholesterol, and one does not have to have all these BP and diabetes. If I have a severe high cholesterol, and if I climb stairs like 10 steps or 20 steps, and I get short of breath, I take ECG. In ECG I see some disorganized waves, right? Like some ups and downs. ECG means you should be able to see ups and downs in the waves, but normal ECG, this is abnormal ECG says that ST depression or ST wave changes, like ST elevation. The ECG is will be able to tell you whether you have any cardiac causes of chest pain, heart related chest pain. Okay, and there are many other tests that will be able to tell us, for example, echocardiogram. It's kind of scan. Then the probe is kept on your chest to see how the heart is pumping and how much of blood is getting out of the each contraction. So we call it ejection fraction. Okay, so this is a heart related chest pain. Okay, so if you have chest pain, do not just sit at home and think, okay, this is stomach related. Oh, no, I had chicken, I had some potatoes, and this could be gas. You know what I'm saying? So if you have these risk factors, try to push yourself to the nearest hospital or nearest physician's office, and just make sure you get an ECG. Okay, chest pain, you should always pay attention to it. Get an ECG done, and some enzyme test is also necessary. Okay, ECG and enzyme test, if these are negative, then you can be cool. You can go home and do whatever your routine other activities. But if these are abnormal, if ECG is abnormal, then the enzyme is normal, it's nothing much to be worried, but then you still need medical attention by a cardiologist or proper physician with cardiac knowledge. Okay, hope this helps. I'll see you soon in another video with more topics or continuation of this topic. Alright guys, thank you everyone, bye bye.